Hi, I'm Fran.
I'm Abby.
I'm Emily.
And we're doing our presentation on arthritis. There are three main types of arthritis. There's traumatic arthritis, osteoarthritis, and rheumatoid arthritis. The three main differences are that traumatic arthritis is an acute onset due to an injury and major damage to a joint, like a car crash. The second one, osteoarthritis, normally occurs in like 50 years old patients and older, because that's just wear and tear of the joints over time. Everything wears down and breaks down, and the joint just becomes decrepit. The third one, and the one we're going to be focusing on for this class, is rheumatoid arthritis, which is brought about by an autoimmune response by ACPA antigens and other interesting things in the body that we will discuss further now.
One thing that we found really interesting was the fact that you can pick apart the words, like root word by root word. So the Latin roots of the words rheumatoid arthritis. Arthur means joint, and itis means inflammation. So there you've got inflammation of the joints. And then rheumat is actually refers to rheumatic fever, which was a disease back in the day. And one of its main symptoms was joint pain. And oid means resembling. So we had resembling rheumatic fever. So if you put all those words together, you get inflammation of the joints that resembles rheumatic fever.
That was pretty cool.
So there's some genetic factors involved in rheumatic arthritis, and they've done these twin studies, which shows that these prove that there's a genetic component. And there's a concordance rate of between 50 and 30% for the monozygotic twins and 5% for the dizygotic twins. And in the monozygotic twins, which they're like genetically identical, they share the same sperm and the same egg. And the dizygotic twins, they're related, but they're not identical. They're like brother and sister, like as close as you can be without being the same person.
And this research also proves that the disease is also highly environmental, because normally in a monozygotic study, you need 100% concordance rates to say that it's completely genetic, because then the identical genomes bring about the identical disease. The fact that only 30%, it means you have another 70% that you have to account for. So a lot of rheumatoid arthritis has an environmental factor to it as well.
If you're a woman,
Are more likely to have the autoimmune reaction that causes rheumatoid arthritis, and this is because their levels of estrogen and progestin in the blood fluctuate throughout their life. So as you can see in our OC, stands for oral contraceptive, and if you've never had an oral contraceptive, you are far more likely, within a certain range, to get a rheumatoid arthritis than if you are, or have used them in the past, or if you are a current oral contraceptive user. And then here, this period postpartum means like after you've had a kid, your estrogen levels decrease. So in the first 0 to 3 months, you can see that there is a very high likelihood of developing rheumatoid arthritis. And then in the around 3 months to 12 months range, your likelihood decreases.
Clinical diagnoses for the disease, it's not very exact, and they don't have any phenotypic expression that they can universally use to diagnose the disease other than joint inflammation, which is what they use to diagnose all arthritis cases. Later on we'll talk about something called ACPA, which starts looking at blood antigen levels and protein receptor sort of stuff in the actual autoimmune response, but it's still not definite, and so the clinical diagnosis pretty much just have to examine the joint either surgically or palpate it, and if it's tender, then you have rheumatoid arthritis. Arthritic distribution.
it can happen anywhere.
any weight-bearing or mobile joint in the body. So here we have a picture of a healthy joint.
Right here, we have this is articulating bone number 1, articulating bone number 2. This is your femur, and this is your tibia, because this whole thing is your knee. So right in here is your synovial cavity, which houses your synovial fluid.
The synovium, important things about that, and the main implication of synovial disease or synovitosis in rheumatoid arthritis is degradation of that medium, and that medium, which supplies all the nutrients and stuff to ligaments and tendons, when it's destroyed, they no longer get it, they die. That's shown in this afflicted joint.
As you can see, this is still the knee. The back, that's synovial cyst. That hurts. It's called Baker's cyst, and you get it when you stand around a lot all day, like a baker.
Yeah, and since all your synovial fluid has come out of your synovial capsule and is sort of over here in this area where it really shouldn't be, both of your bones come closer together, and that's when you get friction and abrasion, and that's what creates bone spurs.
Exactly. We simplified it here. You can see the synovium, which was demonstrated by that fluid, that blue stuff. As you can see, it's spread out over here because it's so damaged, and even in the slide before that, you can't really tell in three-dimensional space where it is. And that
Fran,
red stuff right there? Yeah.
Is this anatomically correct?
No, it's not. Darn it! But it's simplified so you guys understand. Okay, we have the synovium here, big capsule. They have an inner layer called the intima. So intima is right there, and septima. This will be important later when we discuss the two types of mechanisms of disease.
Outside in is the first of two theories that are suspected of causing rheumatoid arthritis. In this theory, the immune system incorrectly identifies these surface cell antigens on the surface of your cells that comprise your intima as foreign, and they think, wow, this is something that's bad and it's attacking me and I need to get rid of this now. So basically it sends in your immune system to like totally kill off these cells, but it's actually your cells, so your immune system is killing your own cells, and this causes inflammation and swelling and just general horribleness in your joints. And so your intima becomes very inflamed, and this can also bring about unlucky Baker's cysts. And this theory is the most supported by the study of viral onset RA, rheumatoid arthritis.
Very true. Look at that transition, it's beautiful. Alright. Inside out. This is less substantiated, less is known about it. The main point of this is that there is some sort of epigenetic mutation caused by long-term smoking, like any sort of long-term bronchial or pulmonary stress causes this inside out. That's what supports it. And since the studies are so long-term, it's hard to draw any definite conclusions because something else or some other environmental factor in the person's life might have caused it. But the main mechanism here is that the bone is changed, which causes a change in the parts of the immune system that are created in the bone marrow. That causes inflammation in the joint, and then the whole outer membrane of the synovium, called the septima, which you saw on the other slide, is destroyed. Synovium gets smaller, and as the synovium gets smaller, the cartilage gets less nutrients, and when the cartilage gets less nutrients, it dies or doesn't function as well. Same thing with ligaments and tendons, and then the bones get close together, they rub together, and